Hello, everyone. My name is Aldrika Glover Hill. The title of my presentation is Health Literacy. And so, to begin, I want to show you this picture. If you look at this picture, the person looks confused. It says you've suffered a contusion to the soft tissue below the fourth thoracic vertebrae, exacerbating the proximal sternum. Translation: you have a bruised rib. So, how many times have you encountered some type of medical jargon, um, whether it was with a loved one, a personal experience? We all tend to find ourselves on the side of confusing medical information. As a nurse, we often use medical jargon when we are doing our routine education with patients, when we are discharging patients. So when this happens, we must take into consideration the health needs and the individualized care of our patients. So according to Bastable, health literacy is the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate decisions. Okay? So I want to stop right there, and I want to do this. I want to put this on my head. Y'all can see I have my hair done. But I want to put this on my head. Because to be honest, I've saw a lot of people in the store like this before. Okay? So, health literacy cannot be simply assessed by just looking at a person. So, looking at me, you think maybe I'm uneducated or something like that. It brings a stereotype. So, in fact, the U.S. Department of Health and Human Services estimates 45% of high school graduates have limited health literacy skills. So, health literacy requires an in depth assessment on all patients to prevent discrepancies in medical instructions, prevent med errors, and decrease morbidity and mortality rates. Even with this bonnet, I still am a nurse and, be honest, have some type of education. So I just wanted to show y'all that. So, when conducting my study, I decided to interview a 73-year-old male with a diagnosis of type 1 diabetes who is post-op recovery from a right great toe amputation. Okay, that's my little picture. Sugar is up and he's holding his foot. His name is JH. JH will be the target audience, and his caregiver, OW, his sister, will also be the target audience. So, OW states she helps with her brother's care, medications, and doctor's appointments. He has several needs once he's discharged from the hospital, which will include wound care, diabetic monitoring, medication compliance, and follow-up visits. OW agrees that the patient is a high priority. However, JH has multiple negative factors working against him. He's homeless, he has limited income, and has a long-standing addiction to cocaine. JH is a high school dropout with a ninth grade reading and writing level. He's been distant from other family members, such as his children, for over 30 years due to his cocaine addiction, and this is something he's not very proud of. JH has weak communication skills, and he also said that he requires someone to speak up for him about his medical care. He likes the motivation to learn and is easily distracted during the interview. So when I questioned JH about background noise level, he prefers minimal noise with instruction and does not mind being seated in a comfortable area. Okay? So, JH has a difficulty understanding terms such as clean and wrap the area. He does not have any type of computer skills and learns best by others relaying his medication instructions and all medical treatment to him. So, since OW assumes care for her brother, she expresses a desire to learn everything she can so he can get better. She has a 10th grade reading and writing level, Before becoming disabled, she worked as a certified nursing assistant and has some knowledge on basic care. She understands medical language that refers to cleaning and applying a dressing to the affected area. OW states she learns best by verbal instructions from the healthcare team, demonstration, and she prefers to go home, read the instruction, and likes maintaining eye contact throughout the interview. Okay. OW learns best in a quiet environment. So, let me just imagine somebody trying to learn something with the radio turned on. It's very distracting. So that's just something we have to remember as healthcare providers when people are coming into our private offices. Turn your radios down. And I know I am notorious for playing mines in my own office at work, okay? She likes, like I said, to maintain eye contact and a comfortable sitting position. So if somebody's sitting down like this, chances are they're not retaining the information because it's uncomfortable. So you want to have them seated comfortably, okay? OW has agreed to move her brother to her home to check his blood sugars, administer his insulin, and provide care such as wound care, all his medications. She's also competent to perform wound dressing changes and be responsible for follow-up care. She also has voiced her brother has limited resources, and she would like to speak with the case manager about dressing supplies, a bedside commode, and wheelchair assistance. OW is strongly motivated to see her brother make a full recovery, but she doubts that once he gets better, he will leave and return to the streets due to his addiction of cocaine. All right? So, the tool for assessing readiness to learn in JH is the test of functional literacy in adults. It's called the TOEFL. And it looks like this. If you can't see it, okay, there's some fill in the blanks with it as well. The TOEFL is the form which measures health literacy using hospital materials such as prescription labels and discharge instructions. It takes 22 minutes to administer, and it tests reading comprehension. So JH was instructed to read one prescription labels to assess how he takes his medication. JA voiced he takes the penicillin every day when the bottle specifically said take the medication every 12 hours. I asked if he took the medicine at 8 a.m. when he wakes up, when will be the next time he takes his medicine? And he said, I'm sorry, he became confused at this point, okay? On the reading comprehension portion of the exam, I asked him to read some instructions and look closely at the area where words are missing. JH was asked to read some instructions and just kind of fill in the blank. He was unable to fill in comprehension words such as agree to provide information to prove statements. So it was determined that he has an inadequate literacy level with reading and interpreting a prescription bottle. JH also demonstrated inadequate literacy with wound care instructions to apply betadine to his wound area and to wrap the area with a gauze wrap. OW, however, demonstrated adequate literacy with questions such as reading a prescription bottle, taking the medication twice a day, and OW was also able to fill in comprehension words in the TOEFL such as agree to provide information to prove statements. OW was also fully able to comprehend wound dressing changes instructions, so she demonstrated adequate literacy. And so I just wanted to show you all this. This is one of my bottles, if you can see it. But sometimes this can be confusing to patients because it says take one by mouth once a day. I think medication bottles should at least say what they are for, okay? And this is also confusing. Take every 4 to 6 hours as needed. It should say for pain. This is my muscle relax, okay? Alrighty. Alright, the learning style for JH, in conclusion, can be described by the Dunn and Durham learning styles. I just wanted to show you all a picture of it. According to Bastable, this model includes motivational factors, social interaction patterns, physiological and environmental elements that affect a person's ability to learn. According to Dunn, emotional and sociological elements play a big part in JH learning style since he must have the presence of an authority figure to assist him with learning. He has trouble staying focused. He's unable to comprehend medication instruction. In this case, Odobia is the authority figure. She's motivated to learn and ask questions about medical treatment, and she wants her brother to make a full recovery. So that concludes my presentation, and I enjoyed learning the different learning styles of how to individualize care for all patients.